Yes, I'm Benjamin Levy. I'm a lung cancer doctor. I'm an associate professor at Johns Hopkins School of Medicine. So it's hard to overstate the importance of palliative care for patients with lung cancer. And I would say that every patient who walks through the door here um, gets or has a discussion about the role of palliative care. And I think patients oftentimes feel like, well, that means I can't get treated, or that means we're shifting the goals of care, or that means we're giving up. And it couldn't be further from the case. I think that palliative care I view as supportive care to be done in conjunction with the treatment. And it's important. It improved, we know from a famous paper about 10 years ago that patients with lung cancer who were either randomized to get early palliative care in conjunction with their treatment versus just their treatment alone, we saw improvements in quality of life. We saw less aggressive care towards the end of their life. But perhaps more important and not necessarily expected, but we're glad we saw it, we saw a survival advantage. And so I think there's a big push from thoracic oncologists and lung cancer doctors to make sure that every patient gets a palliative care referral. Now, the patient doesn't have to go there. Palliative care is, in my mind, supportive care. You're talking about management of uncontrolled pain. You're talking about management of challenges with breathing. You're talking about management of shortness of breath issues. We're talking about management of neuropathy from the chemotherapy. It's not just pain management, but it's supportive care. So breathing, pain, appetite issues, nausea issues. This is where I think having, in conjunction with getting the usual care, one should also consider a supportive care team. And I always say it takes a village. It's not just about the medical oncologist. It's not just about the radiation oncologist. It's about a whole team that's got to get you through this diagnosis. And part of that team, and instrumental and integral to this team, is the palliative care supportive care team. We have a supportive care nurse embedded in our clinic. And every patient who walks in sees that nurse. And again, even if the patient doesn't have any pressing issues, for the nurse to be plugged in to talk about pain, talk about appetite, to talk about GI issues, and then also to talk about goals of care and what the patient's wishes and desires are. Oftentimes, the medical oncologist can't get around to doing that. They should, but they can't get around to it. And they need to have these discussions up front. And one of the benefits of having these goals of care discussions, I always tell my patients, is that we can set shared expectations. As long as I know where you're coming from and you know where I'm coming from, then we can level set. And so there's so many reasons why the supportive care team is critical to the treatment continuum of a patient. And I would say that we're starting to expand that supportive care to look at also integrative care, which patients love, which is things like acupuncture and things like aromatherapy and things like deep tissue massage, these things that haven't really been published on, but certainly in my clinic have made a big impact on the quality of life for our patients. So I'm a big proponent of this, and really I would advocate that patients talk to their physicians about the role of supportive care and potentially integrative care.